Good afternoon, everybody. This is the Washoe County District Board of Health meeting for Thursday, July 23rd. Yep, 23rd, 2020. We're doing this by Zoom. We will go ahead and have a roll call for quorum, please.
Yes, Chair. Chair Novak?
Here.
Vice Chair Brown?
Here.
Commissioner Burkbegeler?
Here.
Councilman Dare?
Here.
Dr. Dinko?
Here.
Councilman Delgado?
Here.
Hey.
Tom Young will be absent, Chair, so we have a quorum.
Okay, good. Thank you very much. Ms. Reed, would you lead us in the pledge, please? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, and liberty and justice for all. Thank you. Okay. Next item on the agenda is public comment. Do we have any?
We do not, Chair.
Okay, thank you. Moving on to item number 4, approval of the agenda. Do we have any additions or corrections to the agenda? Hearing none, do I hear a motion?
Move approval.
Second.
Second.
Okay. First and second agenda, all in favor?
Aye.
Aye. Opposed?
Aye.
Hearing none, moving on. District Health Officer, number 5, recognitions.
All right. Thank you, Chair Novak. Want to begin with our recognitions of years of service, and want to congratulate Charlene Albee, our Division Director for Environmental Health Services. She has 25 years of service with the Health District. She started her career here, actually just under 25, in 1995 at the end of July. And just a warning for the board is that Charlene began her PERS service at the state before she came here. So I think we don't have that much time left with Ms. Albee before she reaches her retirement status with 30 years. So congratulations to Charlene, and thank you for your efforts. And then also Jennifer Howell, our health educator coordinator in CCHS. Jen has 20 years of service with the health district beginning July 3rd of 2000. So congratulations and thank you, Jen. For promotions, Sonia Smith has been promoted to Public Health Nurse Supervisor from her Public Health Nurse 2 position for CCHS. This is a new supervisor position that the board approved for our budget for FY 21, but this is now going to be fairly dedicated to the medical part of the post operations with COVID-19 coming on. And then also Cecilia Bustos is promoted from an intermittent hourly RN to a public health nurse with our community and clinical health services. So congratulations to both of them. We have several new hires, and these are all for the COVID response through the federal grant funding that we've received for the testing and contact tracing. Gaylon Erickson, Gail's going to be working as our COVID administrative assistant 1 in EPHP. Kristen Palmer is going to be our COVID grants coordinator in EPHP, and Kelsey Zasky is going to be our COVID office support specialist for EPHP. All to both the COVID administrative and office support specialist staff are to help support call center and the contact tracing groups. And then we have, this one is a reclassification. It's basically just an increase from part-time to full-time for Anastasia Ganawan, who's a statistician, moving to full-time to help support the COVID-19 response with those grant dollars. Congratulations to all of those. And Shining Stars, we remain at 714. Our people being recognized for Shining Stars has declined somewhat with the fewer customers that we're seeing and people being just so busy with the COVID-19.
We'll let some other group catch up with us.
We'll let them try.
Yes, good idea.
All right. So thank you. That's the recognitions for today.
Okay, thank you, sir. Okay, the next item on the agenda is number 6. It is the consent agenda. Do we have anything that needs to be discussed or pulled from the agenda for further consideration? Hearing none, I'll go ahead and accept a motion to approve the consent agenda.
Motion to approve the consent agenda. This is Rika. Thank you.
Okay, and seconded by Chief Brown. All in favor? Aye. Opposed?
Aye.
Hearing none, moving right along. Okay, that's the end of consent agenda. Number 7, Mr. Dow, wherever you are with whatever you're wearing, we can see. It's your turn.
Good afternoon, Mr. Chairman and the board. You have in front of you our report from last month, and I'm available for any questions, answer any questions that we can related to that report. Additionally, we do have a supplemental report that we've offered to the board, and I'll be ready to discuss that at any time you're ready to discuss.
Do you want to do that separate? The support? Okay. Mr. Dow, if you want to go ahead with that supplemental, I think it's appropriate now.
Okay, thank you very much. The supplemental report was provided to update this body on the status of the emergency medical services system here in Washoe County, and in large part the impacts or challenges to that system related to COVID-19. If you'll remember last month, we did have some questions as to one, sort of the overall impact that COVID-19 has brought about on the pre-hospital care system. And then the second question was related to call type. Have we seen any significant increases in certain call types as we've gone through the last several months? So if we just focus on the supplemental for a minute. Yes, I think just an opening statement to the board that just like all pre-hospital care systems in this country, first response systems in this country, the COVID pandemic has brought about numerous challenges to all systems across this country. In some regard, there's been, I think, some silver lining to this, that in many systems across the country, it's also brought about an opportunity to look at inefficiencies and the vulnerabilities of EMS systems and hospital care in general across this country. So we have had effects here. One of the largest effects noted in the supplemental report comes with 9/11 activity, so the utilization of 9/11 responses across the system. Early on in March, we saw a rapid decrease in 9/11 utilization. Then we've seen in following months rapid increases and then decreases again, to the point that we are currently, over about the last 3 to 4 weeks, experiencing unprecedented historic increases in 9/11 utilization to the system, to the point as pointed out in the report that we have reached system overload 20 times in the last 12 weeks compared to 3 times in the previous 9 weeks. And frankly, historically, I've been here for almost 5 years now, and we've never seen this kind of historic utilization of the 911 system. We attribute some of that to the reopening of businesses, people getting back out, getting outdoors, engaging again in activities, et cetera. Part of it we're attributing to just the healthcare dynamics in our community. Again, not unlike communities across this country, where access to hospital healthcare, physician office type healthcare, elective surgeries has been extremely impacted through the last several months. Some of that healthcare delivery shift across this country, and again, we are no different, has fallen on the shoulders of pre-hospital care systems and first response systems across this country, so effectively increasing utilization. We've had some other factors over the last 4 weeks that we've been tracking. Again, as everyone I think on this call is fully aware that in this state and in our general community, we have a continued increase in COVID positive cases. So our associated ILI or influenza-like symptom request or 9/11 request have also continued to go up and not go down. Also wrapped around this from a technology perspective is the very sophisticated system status management or system deployment software that this organization uses, as well as many organizations across the country. Frankly, we can almost throw it out the window. It was not developed with COVID in mind. Nobody's fault, but it wasn't developed with all the impact of a national pandemic. So our abilities to be very effective, so 90–95% effective as we always have been, in the sense of understanding utilization and deployment, if you will, every hour of the day, every day of the week, 7 days a week, and every day of the month, has been disrupted. So in many situations, our folks that look at this information and look at that software on a daily basis to help us determine staffing needs, et cetera, have really had a very significantly difficult job, because where they've always been good with that software support of predicting the future, if you will, right now the crystal ball doesn't work very well. So we are having to mix and match our staffing, go on field in some cases, if you will. So it's made, I think, the challenge of effectively responding to 9/11 calls and then even inter-facility calls in the system more challenging. One of the questions, again, was, have we seen an increase in certain call types? It is noted in the report that, again, our ILI calls continue to go up. But also in this pandemic, we're seeing significant increases in behavioral calls, psychiatric calls, and assaults. Those call types, interestingly, are basic life support responses, if you will, because there's no other priority symptoms or issues associated with those call types. So if we bundle those call types together, throughout the pandemic, we're seeing approximately 600 of those a month, which is a significant increase over year to date, past years as we keep records. But it has highlighted a couple of weaknesses. One weakness, this organization, not unlike other public safety organizations and healthcare organizations in our region, has been hit pretty hard with the employees relative to the pandemic and having to isolate employees at times for up to 14 days. So we have had approximately 100 employees so far to date that have been in some form of isolation. A lot of those, again, for up to 14 days. as stringent and as cautious and careful as all of our employees have been, and they have done a spectacular job. We have had over the last 3 weeks, almost 4 weeks now, 4 employees become COVID positive. Obviously, they were all quarantined, et cetera, but that hopefully shows you a little bit of just the employee impact and, if you will, the scheduling impact for the availability of ambulances within the 911 system that we as an organization have been challenged with. So again, when we look at the pandemic overall, the impacts to this organization, the increases in utilization, a lot of those increases, frankly, are basic life support utilization increases. And that's something that many of you know this organization has been for many years working to improve sort of population health management, patient guidance activities. So we have done many things in the realm of the nurse health line, utilizing telemedicine, utilizing organizations like Ready Responders to help manage patient population and guide patient population into the right healthcare pathways at the right time with the right level of providers, to where we're trying to innovate and come out of the decade-old model of call 911, no matter what the situation or symptoms. Basically, you get a paramedic level ambulance and go to the emergency room. So there has, as I said, been some silver linings because it has brought new energy and focus to those types of innovative efforts. And I think the summary of this supplemental report to this board is that this organization wants to continue to be proactive in our planning and our ability to use our clinical resources and our human resources and technology as best we can in the changing world. And so we are looking to the board for support of the 10 suggestions for improvement that we have highlighted in the supplemental report. And again, I'd be happy to discuss any of the 10 at this time. Thank you.
Anybody have any questions, comments? Hearing none. Yes, sir.
No, I'd just like to say, I see your 10 supplemental that you provided, Dean, and we appreciate that. You know, this area for years has been utilizing ALS services, and as you well point out, I think in the report, where we could utilize BLS services and keep those ALS providers available for those 911 calls that require those priority of responses. And I think that's one thing that might be good for you to explain, Dean, is you talked about it, but with this increase of calls that you're seeing for the last several weeks, they're not priority 1, priority 2 calls. They're actually a lower acuity calls. And is that because of the COVID situation?
Mike, as you well know, and I think people on the board do, really and truly, it's part COVID, it's part pandemic, but it's also part societal, if you will. And many folks have heard me say that we can go back to March of 2014. And in March of 2014 was really the sort of the green light trigger on the Affordable Care Act. And all systems across the country from that point to today have seen anywhere from about a 10 to 12% increase in 911 call/utilization, again, across this country. And that's regardless if your system is a fire-based system or a not-for-profit like ours or a hospital-based system. That doesn't really play into the equation. It generally for pre-hospital care all over the country. And when you look at that increase, which this organization has done in hundreds of organizations across the country. Mike, you're 100% correct. That increase was not life-threatening calls. It was not chest pains. It was not heart attacks. It was not strokes. It wasn't significant trauma. It was lower acuity, basic life support type call increases because people now had more, if you will, or different healthcare coverage and ability to access healthcare. But where the system broke down, and is still broken today, is that doesn't mean you really get that access to healthcare. A lot of that population doesn't have the access to go to a private physician, clinic, et cetera. So the pathway has really become going to the emergency department. And so the effort of this organization, like many across the country, is to more effectively use the professionals that we have and, again, match the patient and the patient situation to the right provider and then get that to the right clinical, if you will, resource. So it can be an EMT, it could be an advanced EMT, working with a patient and taking that patient to a clinic, taking that patient to a physician's office. It could be a combination of that, along with utilizing the nurse health line, et cetera, again, to guide that patient into the right pathways. So it's part that, and then, yes, part the pandemic and people trying to access healthcare, but not needing that access in an emergent manner or for an emergent clinical need, if that helps answer the question.
It did. Thank you.
Yes, John, I just want to say, first of all, Dean, thank you so much. I think that it's good to kind of get an update and kind of see. I mean, we can look at numbers, we can kind of see that there's been some stretching and stuff, but it's good to kind of get a focus in. I have a couple questions on your 10. One of my first ones is with the police. You mentioned discontinue ambulance response to standby request. Can you explain that and make sure, I mean, is that something that's been talked through with some of the police? And
It is something that we're talking to the law enforcement system-wide. And what functionality change that we're proposing there is historically, they can get a request for a psychiatric call, if you will. We might prioritize that, Chris, as a priority 2, run lights and sirens to the scene, but we're, per law enforcement request, we're being asked to stage like a block away. So we'll send that ambulance, lights and sirens, we'll get a block away, we shut down, pull into a parking lot, for example, and we'll stage until law enforcement gets on the scene and clears the scene. So our request and our conversations with law enforcement has been that we can modify that to where it's a priority 3 response or a non-lights and sirens response. And we can just, when they're available and they're responding, we'll respond at the same time so that we're not being staged for 5 or 10 or 15 minutes until they arrive on the scene.
I understand. That's just everything. Either way, have sometimes unintended consequences. So I just wondering what, I mean, I'm sure there's a purpose why you do what you do, and I'm sure there's things that don't work and work. And I just, if it seems like you're not going to be there, but it sounds like it's just a change of how you're going to do it.
It's a change in how we get there, basically.
And then the other thing I just to point out, I think there's a lot of wisdom in the idea of having almost a second tier, or however you kind of word it through here different ways, but getting non-priority calls to a secondary call or a secondary group. And my question is, I wonder if we have enough telehealth medicine distant place. And I know you mentioned that a lot in here, but I don't know who, it's one thing to say it in here, but who are we working with to potentially help make that happen?
This organization is working with all three health systems related to telemedicine. What that's going to look like over the next several months, not my place to really speak for them on that. There's strong interest from the health systems to enhance or enlarge their capabilities in that arena, in that technology arena. And that, again, is very typical of what we're seeing because of the pandemic throughout the country. We're, I think, blessed here that our relationships with those health systems is strong enough and recognizable enough, and they know that we already do some of this in the rural part of the state, that they see the combined effort as being a good thing for the community in conjunction with, and I think it was noted in the supplemental report, of the concept of treating people in place, treating them at their home, tied to that technology, tied to nurse helpline mechanisms. So again, if they really and truly aren't emergent, really and truly don't need the resources of the emergency department, jointly, we're part of a health system that is guiding them into the right place at the right time.
Oh, it's good. I'm very supportive. Thanks.
Thank you.
Chris, I just want to bring up, we'd started a couple years ago with the EMS committee and stuff, rating calls, reprioritizing a lot of calls with this in mind to try to utilize who and what we have as resources in a better way and not send a REMSA ambulance to a bee sting or something like that. And we've been working on it, but unfortunately, it's kind of had to be pushed to the side a little bit. But this is exactly where we were going a long time ago. And I think it's now, once we get through the pandemic, it's going to be a conversation and really look at, again, what's priority and what's not. We had a campaign started, unless it's an emergency, do not call 911. There are other resources. And I think that's where, as a whole group in the health department, along with the fire ambulance and everything else, continue to work on this in the future because it does save resources for when we really need them. So, any other comments? If not, I hear a motion to accept Mr. Dowell's report.
Make a motion to accept the report as presented, as well as support for what's taking
Second.
place.
In second, I heard a second. All in favor?
Aye.
Opposed? None? Hearing none, it's passed, moved on. Ms.
Thank you very
Jobson, are you there?
I am.
There you go.
Hello. Good afternoon. Good afternoon, Mr. Chairman and members of the board. Alexia Jobson, Public Affairs Manager for REMSA. For the record, you have for your review the Public Relations Report for June. Today, I'll give you an update on a couple of our other more recent activities. At the beginning of the month, we posted digital content encouraging pedestrian and bicycle safety. We also shared important 4th of July safety information on our digital channels, including website and YouTube, that focused on fireworks and heat-related illness and how to stay safe. And then in mid-July, REMSA provided an interview on water safety and what to look out for when you are having fun at the pool in the lake. I'm available to answer any questions you may have about our public relations report.
Any questions, comments for? Hearing none, thank you very much for your report.
Thank you.
Moving right along, we've got a air quality management update. Ms. Albee, are you around?
I am.
Hi there.
Afternoon, can you hear me?
Now we can hear you.
Okay, it's talking to me here, so. Thank you, Mr. Chair, members of the board. For the record, Charlene Albee, Director of Environmental Health Services. For point of reference, at the June Board of Health meeting, the board had approved the waiver for the assessment of late fees on air quality management and environmental health services permits. based on the response to the COVID-19 emergency. The decision of the board was to waive late fees until August 10th, but with direction to provide an update on the status of the permits at the July board meeting. This agenda item is intended to satisfy that directive. The status of late fees has held pretty level in air quality management. At this time, they have 20 permits outstanding for a total value of almost $15,000 in permit fees. That does not include the late fees. And environmental health has seen a huge increase. We have almost doubled what we had outstanding last month to 347 late facilities this month across all of our programs. It's not just food, it's all of them. Now totaling over $145,000 in outstanding permit fees, not including the late fees. When the request was made to waive the late fees, we were trying to accommodate the governor's directive with the phase 1 and phase 2 openings, and then we're calling it phase 2.1 when the casinos open, that with that 60-day direction, August the 10th would have accommodated all 3 of those opening days. Since then, we've actually had the directive to return a number of facilities back into phase 1, where they actually are closed, primarily the bars. And it's become really difficult to track who's in what phase and what's due when. And so we are presenting this agenda item today to see if it would be possible to extend the assessment of late fees until September 10th. That'll give 1 more month. Hopefully the control measures that are in place now with the directives for masks being mandatory and some of the other, reducing the size of public gatherings, that some of those control strategies will actually start to have a benefit, and we'll be able to see that in the next month. So that will hopefully help those businesses get back up and open again, and will be able to fulfill their permit fees. And with that, I'm available to answer any questions.
Any questions, comments for Ms. Albee?
Question I have on that, I see the need for what you talked about. Is that something that has to come back to us, or is that for actual vote or whatever, or is that something that can just be decided?
Well, right now, the way it's set up, it would be, we'll vote on it now to extend it to September the 10th. It might be something that's just going to have to be an agenda item until we get out of the pandemic. So we may have to do this every month until we see that there's kind of a letting up of what's going on. So
Sounds good.
Do I hear a motion? Mr. Dare?
Yes, that is a motion. I agree. And thank you for continuing walking with everybody. And I can imagine the confusion even on our end trying to figure it out. So I think it's a good decision.
We got a motion on the floor. Do we have a second?
I'll second.
Okay, good. First and second, all in favor of the motion?
Aye.
Aye. Opposed? Hearing none, motion's passed. Thank you very much.
Thank you.
Next item is our COVID-19 emergency response activity. Mr. Dick?
Thank you, Mr. Chair. The health district staff continue to do an incredible job in their efforts in responding to COVID-19. People are working very hard beyond whatever I had expected they'd be able to accomplish. They're just continuing on. So we're continuing with our testing and contact tracing activities. We have the post set up and dialed in very well for moving people through for testing. We set a record last Friday of having 665 people come through the post for testing, and continue to get feedback from members of our community about how impressed they are with the efficiency and the organization out there. We are benefiting from the Guard helping us, as well as the CERT volunteers and the MRC volunteers. It's amazing. There are people that have been out there for months when we are operating, each day we're operating the post, volunteering and helping with that effort. So we thank them very much. We have moved the post operation to 4 days a week last week and this week, and then we're moving to 5 days per week next week. We also worked with the Health Plan of Nevada since the last board meeting for a post that they held in the 89502 zip code area down at Miguel Rivera Park on June 26th and 27th. We're continuing to also work with our first responders and our long-term care and assisted living facilities to provide them with test collection kits for their testing. We also have first responders that are and healthcare providers that are coming through the post for testing. As you've heard on the news, there's backlogs that are going on and delays receiving testing results because the labs are overwhelmed with the number of tests that are coming in. The same is true of the Nevada Public Health Lab, State Public Health Lab. They've done an excellent job throughout, but they're now receiving the volume of test specimens that they have a difficult time keeping up with. So we may have 4, 5, 6 day delays in getting test results back from the state lab. Some of the commercial labs are 7 days or more for getting test results back. So that is hampering our case investigation and contact tracing efforts when we have that delay occurring before we even get the results back. But we're also having trouble keeping up with the volume of the results that we're getting as well and the positives. So we've moved to a kind of a two-step approach with the positive cases. They're initially notified that they're positive and that they need to isolate so that they have that information quickly and can begin their self-isolation. We're working right now to get finalized a more comprehensive information packet to provide to them electronically at that point of communication. But then it's at this point a day or two at least of a delay for our case investigators to be able to contact them and go through the interview process and identify all of the close contacts. Because of the increase in the COVID cases that we've seen, because of the increased demand for the testing through the post, we have put together plans for additional staffing that we need moving forward. We're just about wrapped up with getting the staffing on board that we had identified originally with that $10 million of grant funding that we received from the federal government through the state to support the contact tracing and testing. But we need, we believe, at least about 50% again, additional staffing to be able to continue to operate the post 5 days a week, to be able to do a better job of keeping up with the contact tracing and testing. So we've made a request to the city managers and the county manager to get a portion of the CARES funds that they have available allocated to support the contact tracing and testing. We've also asked for a portion of that funding to support us being able to work with a commercial lab to be able to procure additional testing. So we're working to pursue that. The managers are meeting this afternoon, and I'm hopeful we'll have a decision on that funding allocation for us. The other item that I included in my report is the seroprevalence study, and I sent the board all the results of that. But that was a huge effort in conjunction with UNR and the Nevada State Public Health Lab. And the results of that study were findings that we have probably about, well, we found that there were about 2.3% of the population of Washoe County that had been exposed to COVID-19 as of June 9th and 10th, when we did the sample collection for that. What that means is that we probably have about 4.5 to 5 times the number of cases at that point we did in our community as we had identified through the testing that we had conducted. Another thing that provides for us is understanding that there were probably on the order of 5 times as many cases as we identified through our testing.
Excuse me.
Gesundheit.
Times 3.
So we had, so knowing that we had a larger number of cases in our community, then when you look at the number of deaths that we had had, and to calculate the percentage of fatalities from the disease, you then use that larger number of cases as the denominator when you divide the numerator, the number of deaths. So that understanding tells us then, rather than having a fatality rate of around 3.6%, the fatality rate is probably much lower at about 0.8%. That's still, though, quite serious. It's about 8 times as fatal as the flu. But it's good information to have on what we think the extent of the COVID-19 cases are in Washoe County. And I think it's one of the better efforts to date in trying to really do a population level type of approach with the way that study was designed. And then Susie has up on the screen the dashboard that we have on the COVID-19 website. And you can see that we had a spike in cases right around the July 4th weekend. We had a peak of around 90 new cases occurring per day. But then over the last 2 weeks, you can see we're now climbing again with new cases per day. And we are, as of yesterday, we had our 7-day moving average was 75 new cases a day. So that's up from around 60 new cases a day that we were at back on the 12th or so of June. So we're continuing to increase with our case count. On Thursday of last week, Thursday evening, the governor released the White House county-by-county assessment of COVID-19 transmission occurring in Nevada, and Clark County was identified as red, and Washoe County and Reno were included in that as yellow, based on the number of cases that we were reporting and the test positivity rates. The governor requested that we provided information back to his office on what we had done in regards to recommendations that were contained in that White House report and what we were going to do. And we had done quite a number of things already with bolstering our testing, bolstering our contact tracing staff, et cetera. But one of the recommendations was to limit gatherings to 25 or less. And so last Friday, we began messaging that, put out a press release, and have included that in our press briefings as well, of recommending no gatherings of 25 or more based on that document and the governor's request for action on it. The governor has also put out a criteria for elevated disease transmission tracking across the counties of Nevada that went along with that. And that includes some measures such as the average number of tests per day, and we want to have 150 or more per 100,000 population. We're running at about a little over 1,000 tests per day. We're getting results on here in Washoe County through July, so we're over 200 per 100,000 on the tests, so we're meeting that. The other one is a case rate of, the threshold is 100,000, or I'm sorry, 100 cases per 100,000 over the last 14 days, and we far exceed that. We're at 180 cases per 100,000, or 190, I'm sorry, cases per 100,000 over the last 100 days right now. And then alternatively, if we have a testing positivity of greater than 7%, then we're supposed to meet a case rate per 100,000 of 25 versus that 100. And our testing positivity, we believe, is around 8%, maybe a little bit higher. It's actually a number that's hard to dial in, and our epi staff and statisticians are working on that because it's got to be on the testing positivity is based on the date that the specimen was collected, what percentage of those tests were positive. And so we have to look back in time, and it takes a while for those lab results to roll into us and to then sort them back out to the day that they were collected. So this is going to be kind of a lagging number for us because of the way that it's calculated, but we're working on getting that one squared away. So I think that's what I have for the COVID-19 update. I did outline the additional staff that we've brought on board with that grant funding. And I do have the school district in my monthly report, so I think should wait until talk about that when we get to that item.
Okay, thank you, sir. Any questions, comments for Mr. Dick? Hearing,
Hey.
Yes, sir.
Yes, again, to all staff, I just think it's always important that during this time, thank you for staying on the front line. Thank you all for pushing forward. Kevin, good job. And I just want to encourage, I do believe that, I like what you're just talking about, that we're potentially working on some of our own lab stuff. I think that was part of what you shared with the community labs here. It's really hard if we're going to work really hard to be more and more efficient if we're just sending stuff away to only have it sit there. And this is not going away anytime soon. And so I'd like to continue to hear more information about that as we go.
Happy to provide that.
Thank you.
Any other questions, comments? Hearing none, I'll accept a motion to accept his report.
Motion to accept the report.
Do I have a second?
Second.
Okay, good. First and second, all in favor?
Aye.
Opposed?
Aye.
Anybody opposed? Okay, hearing none, it passes, moving right along. And thank you, Mr. Dick. I do want to apologize. I had to do that demonstration right in the middle of this, why you wear a mask and why you keep socially distanced, but thank you for the blessings. So, moving right along to staff reports. Let's see, who's first? Program. Francisco, are you around there? Air quality report? Okay. I think Francisco.
Yes. I'm here. Can you guys hear me?
Now we can hear you. I thought you were napping.
No naps here. Francisco Vega, Director of Washoe County Air Quality Management Division, for the record. I don't have anything to add to the report and program update, but I'm available to answer any questions.
Okay. Any questions or comments for him? Hearing none, thank you for the report. Okay. Lisa Lottridge, we're Community and Clinical Health Services.
Good afternoon.
Hi there.
Division Director of Community Clinical Services. I just wanted to add to our report that we are going to be having 3 back-to-school immunization clinics coming up on 3 consecutive Saturdays, August 1st, August 8th, and August 15th. And those will be at the Boys and Girls Club at the Pennington facility. And what we're going to be doing, this is in collaboration with Immunize Nevada, and Walmart is going to also be participating. We're going to be making appointments and doing pre-registration to help with social distancing. We have a plan for how the facility will look, and just trying to get as much information as we can from people before they get there. So once they're there, we really just have to draw the shots up and immunize the children. We have hired so far 9 intermittent hourly RNs to help with the testing, the COVID testing at the post. And they are in the process of onboarding with us right now. And then as of today, we posted on the job board to hire intermittent hourly community health aides to help as testing assistants at the post, which will help us to save the RNs to actually do the test and better utilize our resources. And that's all I have, and I'm happy to answer any questions.
Any questions? Ms. Autry, what kind of immunizations are you planning on?
What will we be doing?
Yes,
We'll be doing all of the required immunizations for school. So
Okay, good.
MMR, Tdap, sorry.
Good, thank you very much. Okay,
And
any other questions? Okay, flipping pages on there. Back to Ms. Albee, Environmental Health Services.
Good afternoon. Charlene Albee again for the record. I think the only thing that I would add to the report that we provide is that we are doing some programmatic changes as far as how we're going to be getting our routine inspections completed in light of the continued loss of staff to the COVID response. So we basically looked at our stack of work that we have to finish and the resources we have available. So we're going to be assigning work on a weekly basis so that hopefully, if everything goes well, we should be able to complete at least the first inspection of all of our facilities by the end of December. This will be a new way for the inspectors, the seniors, and the supervisors to work together. But hopefully this will also increase the communication levels. When the division got essentially broken in half, our communications has really been struggling because we've had people in and out of COVID even day-to-day basis. So we're hoping that this is going to build some of that communication lines back up, and then also have people feel like they're not trying to get it all done, the burden of everything all at one time. So hopefully we can streamline that process. And then one other announcement, we did offer a supervisor position to Mr. David Kelly yesterday. He has been a senior in the land development program. This will be filling the vacancy that was left by Tony Macaluso's retirement. So you should be seeing that on the report next week. But we do have a new contact for land development, which includes our safe drinking water program.
Good.
End of report.
Any other questions? Okay, well, thank you, Ms. Albee. Moving right along, Ms. S.
Okay.
There you are.
Okay. Chair and members of the board, for the record, Andrea S., Acting Division Director of Epidemiology and Public Health Preparedness. You have the report I've submitted, and I'm available for any questions that you may have.
Any questions for her? Hearing none? Very good. Thank you, Andrew. Nice report. Okay. The long-awaited District Health Officer report.
Thank you, Mr. Chair. I'm not going to be quite as quick as some of the others. We just had a special session, and believe we've got Joelle Gutman-Dodson on the phone, or there she is on the screen, to be able to give us a report on
Hi,
the special
Joelle.
session.
Hi, Dr. Novak. Hi, everyone. I hope everyone's doing well. I just wanted to give you a small summary of the 31st special session we just ended. It started on July 8th, and then it was a long 12 days, a lot of waiting around. But according to our Nevada State Constitution, we have to have a balanced budget. So the governor had originally proposed a $1.2 billion budget cut to balance our budget due to the revenue deficits from COVID. So after 12 days of a lot of back and forth, there were only some real moderate revisions. About $188 million were restored. And largely that went back into the HHS fund. Originally, that fund was cut by the HHS budget was cut by $233 million, and 81 million of that was restored. Some of the restorations of things that were restored from the governor's original proposal were I say optional in quotes, the optional Medicaid, which is podiatry, dentistry, and ophthalmology. So those things were restored. The vape education fund, which is great news for us. The family planning fund, which is great news for us. Some mental health and some child welfare services were also restored. Hold on. And then another 50, so of the 188 million, about 50 million of that came from the state portion of the CARES funds. So that 50 million will go towards K-12 education, directed towards children that will disproportionately be affected by distance learning. And then another part of that budget was balanced with about 47.6 million from the GST fund that originally is given to local governments. That's going directly to the general fund. And then some other money was restored from the highway fund as well as NDOT. And then some other great news for public health, it was that our pollution control fund wasn't swept, and neither was our tire fund for solid waste. Those things are pretty well protected with NRS, that they couldn't be swept. They have to be kept for certain spending purposes. I'd say everybody's going to be hurt by this budget, obviously, but our biggest impact is going to be the 6% across the board Medicaid rate reduction. So that's going to affect our clinical services, anything we bill for Medicaid, as well as obviously our REMSA franchise agreement. So that was special session. It's hard. I think it was hard for everybody to watch. It was hard to see all of this progress we've made in the last 4 or 5 years or so has been kind of put to a halt right now. And right now we're waiting for the second session to be called, the second special session to be called. We're hearing maybe as early as Monday to discuss some election reform, things like that, and possibly liability issues for COVID. But we will see. We don't know what the proclamation will hold. And then one more update from a legislative perspective is tomorrow the interim health services, the interim health committee, tomorrow is the due date to submit policy requests for the 2021 legislative session. So on behalf of all 3 local health authorities, Dr. John Packham is submitting our priorities. And they're nothing new from last session. They're things that we submitted that we had as our priorities last session as well. So we're going to go after the Public Health Improvement Fund, reforming the classic vehicle license plate loophole that we have right now, tobacco 21, sex education, and minimum data set will be our top priorities for next session. And I'm here for any questions if anybody has them.
Any questions for Joelle? If not, we'll move right along. Thank you very much, ma'am. Mr. Dick.
All right. See, a couple of different things that I wanted to also highlight. Very proud of the District Health Officer staff. They're continuing to step up to help with COVID-19. Susie is on the phone with Spanish speakers, doing work with case investigation and contact tracing, doing translations for us. Rihanna Lavoie is still leading an EPI team for the case investigation and contact tracing. Felisa Hilliard has been also busy with answering calls, providing admin support, helping to recruit participants for the convalescent plasma study work. So everybody's still continuing to work outside of their normal areas with that support. We have been working closely with the Washoe County School District to help with plans for their future as they work to reopen. We have been participating with them in developing outbreak response protocols and updating those, so been weekly calls occurring with that. I had a call yesterday with Dr. Kristen McNeil and her executive team to discuss whether they should be reopening or not. And they have a Board of Trustees meeting for that discussion with their board and a decision next Tuesday. They've asked me to participate and provide an update on COVID-19 and my recommendation for what they should do as far as reopening physically or not. Based on the county tracing or the tracking criteria that the governor has established, and the fact that we are far exceeding that threshold as far as the new cases per 100,000 over the last 14 days, and that we are continuing to see an increase in our new cases over the past couple of weeks, my recommendation is that they not reopen right now. The state of California, which has a much more robust public health agency than we do, with many more epidemiologists and scientists, has also made the decision that they're going to use that their county tracking system as a determinant for whether a school district reopens or not by county. And so the governor has a similar tracking system that he's put in place, and I think that it's advisable to go with that threshold for reopening. I talked with the Washoe County Medical Advisory Team member of the governor's team, Dr. Trudy Larson. She's in agreement with the number of cases that we're having right now, that it's not advisable for the schools to reopen. What I have said repeatedly when the press has asked me about school reopening has been that, yes, I'm concerned about it, but I have a public health perspective on this, and this is a multifaceted decision that the school board must make. So while my recommendation from a public health perspective and where we're at with the elevated disease transmission that's occurring within Washoe County will be not to open, I recognize that there are a number of other factors, important factors, that the school board needs to weigh in making that decision. And that decision won't be mine. That will be a decision made by the school board.
What's that criteria number, the California, and we've reset?
So that's the one that's, the threshold is 100 new cases per 100,000 population over the last 14 days. And I haven't seen our case numbers today, but as of yesterday, we sat at 190.8. So we're much above that.
Got a lot of work to do.
They've also got that other number, if your positivity rate, in California, they're using 8% as their positivity rate cutoff. If your positivity rate for your testing is over 8%, then in California, they would want you to be down to 25 new cases or less per 100,000. So we are still at very high disease transmission here in Washoe County. Thankfully, we're not at the levels that they're seeing down at Clark County now, but our levels are certainly concerning, and that's why we're rated yellow by the White House and through the governor's tracking system.
Good. Thank you.
As well. One other thing I also wanted to mention is yesterday received a letter, and in my report I note that Scott Oxford is continuing to lead our Joint Information Center, doing yeoman's work with our communications. But we did receive a letter from the Northern Nevada Subcommittee of the Nevada Hispanic Legislative Caucus COVID-19 Task Force, and they would like more information on specifically what the Joint Information Center's COVID-19 Latino outreach plan is. So we will be providing response to them on this. But I can also let the board know that we had a meeting. It was actually spearheaded by Dr. Novak to talk about how we can do more messaging and campaigning around COVID-19 to engage the community positively in participating in their role individually to help to stop this disease. And so from that discussion with the city and county managers and some of the communications team members, they are now working with Eric Brown and the Regional or Joint Information Center to get a marketing firm on board that has some of the professional expertise for how to effectively influence people and their behaviors to help with that messaging. And they also are working, as they bring a marketing firm on board, to make sure that they have a Latino capabilities and perspective in the campaign that they're going to be putting together. The other thing I wanted to note about the letter we received from the Hispanic Legislative Caucus is that they do have other participants in their task force, and it appears that they would be willing to help us with our messaging as we move forward, and I'd like to be able to take advantage of that moving forward, and we'll see where we end up.
Thank you.
That concludes my report.
Well, thank you. Obviously, Mr. Dick has been a little bit busy in the last couple months, so. Okay, any other questions for Mr. Dick and his report? Okay, hearing none, moving along. Board comments. Is there anything for the good of the group that needs updated announcements or things to be put on future agendas? Okay.
This is Christopher. One of the things that we've been involved with, and I know that Heather from our board, I forget her last name, starts with K, but, and I know Kevin, they've been talking to you a little bit about with the potential of putting this thermometer type situation together, something that would help give indication to businesses as we walk forward. And so I think that's something that we're probably ready to be on in a conversation next month and see if we could maybe bring them, some of the doctors together and just kind of start getting that conversation going amongst us so we can be a part of that.
Okay, thank you. Any other comments or anything for the board? Okay, hearing none. Any public comments come in?
No public comment.
Mr. Chairman?
Yes.
Hi, it's Chief Nolan, Reno Fire.
Yes, sir.
And so, good afternoon, and I think that my reputation as being long-winded preceded me because I wasn't allowed in on the call for a little while. But anyway,
You caught us.
I caught pardon me?
We caught you.
Okay, so I caught the better part of Mr. Dow's presentation on item number 7 and had received from Chief Cochran some notes regarding the presentation, and I think that anything that we can do as a system to improve patient care and response times we absolutely support, and our partners are always very innovative in streamlining their services and how they provide them. Some of the proposals would absolutely have a impact on the fire service responses, and so I would request from the board that they formalize a meeting between the fire services and REMSA with regards to their proposals, and whether we do that through a subcommittee of the board or through the EMS oversight, but we'd like to have a formal facilitation of the proposals that they presented to make sure we're all on the same page and that we can move forward with those proposals which are going to work best for our citizens.
Well, thank you for that. Chief Brown has already started some of those initial conversations along this line, knowing that people are going to be involved down the line. So, anything else?
Yeah, Mr. Chairman, so I understand Chief Brown is having formal discussions on behalf of the Board of Health or behalf of the Washoe County Health District, or is it more of an informal discussion?
Well, we're going to have to make this just your public comment. It is being worked on, and there can't be any decisions. This is not a separate agenda item, but there is progress being made in that direction.
Okay, thank you.
Anything else? Before I adjourn the meeting, I do want to thank all of the people in this health department for going above and beyond anything that was imagined in the past. We've got a health officer that needs a good vacation too, but we're not going to grant him that anytime soon. But thank you for all your work now. The National Guard will be leaving us soon. I want to thank all their extra efforts they've made, along with the MRC, the CERTS group, but we're going to miss the Guard drastically. We hope someday they can come back and help us because they've been innumerable. And the last point, thank all our first responders, those guys out in the field 24, and women, I don't mean it that way, for their 24 hours a day, 7 days a week, the fire, the police, REMSA, they're our backbone for everything we do. So thank you very much to all of them. And I will adjourn the meeting. We will see you next month.